So what is cancer-related financial toxicity? This is the financial burden of cancer treatment due to either being uninsured or underinsured, and or just the high cost of cancer care that's not covered by someone's health insurance, or things that are above and beyond what's covered or even excluded. Patients can incur those out-of-pocket expenses for treatment, also experiencing a reduction in income due to missing work. And in some cases, they even have trouble paying for basic needs like paying their mortgage or their rent, affording food, electric bills. They have to kind of make a decision between whether they're going to get their cancer treatment or take care of their family. So this can cause an enormous amount of strain. This can lead to overwhelming debt in many cases, and sometimes even bankruptcy. Patients can often verbalize their concerns to you, whether it be as an inpatient or in the clinic environment. Sometimes patients won't come to you. Some cultures, they don't believe in talking about those kinds of things, or some people just don't feel comfortable talking about it in general. And it's something that you kind of need to, break that conversation open and come to them so that they feel comfortable talking to you about these things, so that you can help them and give them resources. You want to make sure you connect them with the right people so that they can get the help that they need if they need help. That conversation may go something like this. The patient says, I just don't know how I'm going to pay for this. Or I don't, do you know if my insurance is going to cover my hospital stay or my surgery? Your response could be something like, I understand that this can be very overwhelming and that you have financial concerns about your treatment. Our team is here to help you. We've got some people and some resources in place. With your permission, I'd love to connect you with fill in the blank, your financial counselor, your financial navigator, your nurse navigator may have those resources, or even a social worker, depending on your work environment and what's available to you. What are some cancer-related financial toxicity resources that you can share with your patients, and that are also good resources for you to learn more about cancer-related financial toxicity? There's a couple of organizations specifically that I've given to some of my patients that are extremely helpful. One is called familyreach.org. They offer financial education, financial coaching, resource navigation, emergency relief funds to patients and families when they're diagnosed with cancer. It's a 501c3 organization, so they've got those resources available. People just need to reach out and follow the process and ask them for help. That's what they're there for. Another organization is called triagecancer.org. This organization is also 501c3 nonprofit, but they help both patients by offering free events, education, and resources for them and their families to help them through this situation, treatment and everything. But they also offer resources for us as nurses so that we can educate ourselves to be able to better help the patients. So it's a great website as well for you to go to and find some additional resources and assist your patients in navigating through this process and getting them through their treatment into survivorship without hopefully carrying that financial burden with them. If you need any additional information, I'm sure that your social worker or your financial navigator at your facility will have those resources available for you that you can learn from and give to your patients. I hope this was helpful for you.